I like to think that we do have patient-centered focus. I think we really spend time with people, and that's part of what I love about my profession. But in this practice, I'm able to accomplish that, and my other therapists are as well. So we have dedicated scheduled time for our patients where we spend time and we listen to them and we help them. And we develop relationships in the process, which I think is part of the healing aspect as well as the physical. I think we have just a large number of areas that we work with. We see a lot of post-surgical type patients, and that might be knee surgery, hip surgery, shoulder surgery, back surgery, so forth. I do think we work with a lot of neck pain, back pain. We see that quite often. A lot of general shoulder pain. We do see some generalized weakness. Some situations where someone's maybe been unable to be active, and so we help build them up back to their previous level in strength and conditioning. We do work with kind of some specialty groups such as runners and athletes. It's running is an area that's a very interesting in terms of the keeping people healthy, not just getting them healthy, but keeping them healthy, looking at their body mechanics and so forth. So I really enjoy working with that group, and I think we have a lot to offer. In that area, we do use a technique called postural restoration, which I think really does get to the root of what's happening with our patients and addressing, inefficiencies with gait. Also looking at maybe if there's some weakness, some that's not symmetrical, and addressing that. So those are some of the things that we really enjoy work with. But we do have a unique practice in that we don't have one specialty area. We serve a lot of different needs. It's a good question. In the state of Nebraska, it is direct access, so you can come to see us directly without a referral. Now, the caveat to that is that we do, with Medicare, we do have to have a signed plan of care from the physician. Some insurances will require a signature from the physician. We do have a great relationship with our doctors we work with, and so there's a lot of flexibility we have that way. But we certainly can see anybody coming in with a problem, and very willing to even do a screen to talk with people about what direction they need to go, and that might be a visit to the doctor, or it may be something that we can address right at that time. I think they would expect to feel comfortable. I think they'd expect to have a positive, encouraging environment. And I do think they will also expect to work hard. And I do think they will have many things they can work on at home, and will need to in a partnership with their physical therapist. But I do think they can feel comfortable in entering into our clinic and knowing that they're going to be taken care of. Well, I think sometimes we hear the term pain and torture, and I do want to debunk that. We really do want to return function, and I think we see it as, again, a mission to get to the core of the problem. And I think we treat pain, and we do treat discomfort and things of that nature in recovery. But I think we also look much beyond that and into the future. And I think that's what makes physical therapy very unique, and will be something that is continuing on.